morning, my name is Jennifer Thompson. If we can really understand the problem, the answer will come out of it, because the answer is not separate from the problem. This is a quote by Jiddu Krishnamurti, an Indian philosopher and writer who lived from 1895 to 1986. The reason why I chose this quote is because 80% of you that responded to the audience analysis stated that you did not know what a health disparity meant. While I myself am not an expert in health disparities, I have been mentored by many authorities in the field, as well as spent 9.5 years working in the public health sector. So today, the purpose of my speech is to inform you about health disparities. And when I am finished, I hope you'll have a better understanding about what the term health disparities mean. Today we're going to discuss what the term health disparity means. We'll also discuss some relevant health disparity data. And finally, we'll discuss what is being done to combat these disparities. The National Institute of Health, National Cancer Institute, describes health disparities as differences between groups of people. These differences can affect how frequently diseases appear in a group of people, how many people get sick, or how often these diseases causes death. The U.S. Department of Health and Human Services Healthy People 2020 project describes a health disparity as a particular type of health difference that is closely linked with social, economic, or environmental disadvantages. These differences may be related, but not limited to, groups of race and ethnicity, national origin, and/or geographic location. So now that we understand what the definitions of health disparities are, we can move on to how these differences are measured. And in order to see the differences in our population, we first need to see how our population breaks down. The same Healthy 2020 project describes our population according to the 2008 census as approximately 304 million people living within this country today. With those 304 million people, 33% of them identified themselves as being part of a race or ethnic minority population. The National Health Disparities Health Report, which is an annual report released by the U.S. Department of Health and Human Services and is required by Congress, identified in April of 2012 that simply some Americans receive worse care than other Americans. These identifiable measures that this report, the identifiable measures that the report looks at is about 250 things, ranging from how often disease rates appear in different populations, limited to, the death due to chronic diseases, effectiveness of preventative health care, and finally, the ability of a group's ability to access care. So many of you might be wondering, why is it important to monitor why is it important to monitor why a group might be able to access health care? Well, it's simply put, how healthy do you think you could be if you're unable to see a doctor? So continuing along with the report that was released this year, it outlines the persistent challenges that racial and ethnic minority groups face. Specifically, 50% of the measures tracked by the Health Disparities Report concludes that within the years of 2002 to 2008, health disparity groups, such as minorities, have a more likely chance to 50% of the measures that track the disparities in healthcare access, such as difficulty getting care, between the years of 2002 and 2008, there was no change. In addition, during that same time frame, Latinos, American Indians, and Alaska Natives showed no improvement, and an exception experienced worse access to care than whites. In addition, African Americans experienced worse access on slightly more than 30% of those 250 identifiable measures. So now that we've talked about what a health disparity is, how health disparities are measured, and some pertinent data, we can talk about what is being done to fight these disparities within our country. Specifically in 2010, with the passing of the Patient Protection and Affordable Care Act, sometimes also referred to as Obamacare or the Federal Health Care Law, the National Institute of Health announced the transition of the National Center on Minority Health and Health Disparities to transition to the National Institute on Minority Health and Health Disparities. This is significant because as an institute within the National Institutes of Health, they now may be able to play a key role in participating in the agency's research as it pertains to national health disparities. In addition, they are now responsible to be able to plan, coordinate, and review all of NIH's minority health and health disparity data. This is critical to ensure that the ongoing research is done to further identify why disparities exist. Some of you may be wondering, well, why is it important for a government organization as opposed to, say, academic society? Well, local, state, and federal governments, as well as healthcare personnel and even academic communities, can all agree that health disparities exist. However, they cannot agree on what needs to be done about it. That's why it is important for one federal agency, whether it be federal, state, or local, to try to set the standard. So in conclusion, today I've informed you about health disparities. We've talked about the definition of health disparities, we've talked about how health disparities are measured in our country today, and also what is being done to combat these disparities. In closing my speech, I'd like to leave you with one more quote by Krishnamurti, and it's simply, "It is no measure of health to be adjusted to a profoundly sick society."